It is indeed a privilege for me to stand before you this morning and welcome you in today's program of reviewing the Social Health Responsibility Campaign. I would also like to take this opportunity to highlight some key issues. We have come to learn that any campaign to be successful, community participation is of utmost importance. Community participation in the form of correct information dissemination to actual physical participation of the members, motivated by a clear sense of social responsibility and not out of compulsion or mandatory duty. And I believe that we have achieved that this time. It is worth mentioning that information dissemination and participation of community through the initiative of the DC and the AKMWP have been found to be very effective and well received by the public. Now, why NCDs? Non-communicable diseases has become a major health problems in both terms of morbidity and mortality. However, early detection and early treatment, which include lifestyle changes and eating habits, bring about a significant reduction in the long-term complication and mortality, that is death.
And under the theme, leave no one's health behind, invest in the health system for all. So along with this coverage, we proceeded on with the consultation from our NLTV that under this comprehensive healthcare, primary healthcare, we have 12 expanded packages, services, and from there we chose to look into one of the package that is screening and comprehensive management of non-communicable diseases, and to reflect on two non-communicable disease which is so common now, that is hypertension and diabetes mellitus. We all know that India is faced with the dual burden of non-communicable disease as well as the communicable diseases. And all this can be prevented with early diagnosis, early management, providing health education and timely referral. So with this focus in mind, on 15th of January 2022, under the chairmanship of our District Health Society, Kohima District Deputy Commissioner, along with our President, AKMWP, and the ward chairmen, we have 19 wards with pockets of 50 colonies. We had a sensitization, and we thought we'll take this package forward to go to the colonies to have mini health camps for diabetes and hypertension. And we will go through the presentation and we will see what we have done. On that day, on 15 January, we had sensitization, awareness, and short training where we decided to go for household assessment and take a survey of the household.
Approached me for starting this campaign. I was very apprehensive as to whether we should carry out this exclusive campaign. But as we interacted more, understood the various elements of the campaign, I also was won over by them, and then we decided that we carry out it. And it was at the right time, I think, that we have started this campaign. This is, I think, not only in Nagaland, but in other places also similar things have been carried out. Why I'm saying at the right time? Firstly, there are a lot of lifestyle changes which are taking place within our community. A lot of people are coming from rural areas to urban areas, settling in urban areas. In urban areas, we are getting more and more dependent on mechanized transport. Our exercise, the body needs exercise. The amount of time we spend on exercising our body gets down, is much lesser than when we are in the villages, we are spending more time at work. We are required to spend more time at work. At the same time, our eating styles also are changing. With easy availability of food, we don't have to go to the jungle to hunt for our food. We have easier import of food taking place from outside the state. So with easier and cheaper food available compared to the earlier times, our calorie intake also has gone up. Now these two are factors which affect our health in various ways. At the same time, for various reasons, we are also, not only in Nagaland, but world over, we are getting more and more susceptible to pandemic-like diseases, as pointed out by Dr. Theo. COVID brought it out very clearly that we need to know whether we have some other underlying health condition in order to tackle these pandemic. Like we need to know whether we have a disease which is undetected, which may affect us severely if something else also comes in. If COVID-like condition comes in, if you see the data of COVID related diseases, the mortality, those who died were mainly because of the other underlying conditions, and mainly on account of those conditions related to NCDs, as they call. NCDs means hypertension or disease. Doctors know it, but I'm repeating it for the other layman like me. Now, in order to deal with this, public health response says that we should focus on prevention rather than the treatment part. If we can prevent the disease, that is the best public health response which is possible. And this is what, as a community, as a society, we should be doing. So this campaign, as part of the outreach through the health melas, by increasing the awareness, if it has been able to achieve in some manner by bringing in those preventive elements. Preventive elements means how? We change our lifestyle, we have more exercise, we control our diet.
I'd like to appreciate and give thanks to our CMO, or Deputy Commissioner, and all the AKMWP members who have committed yourself to screen the whole Kohima urban area. This is a very, very good initiative in the history of Nagaland. It's just beginning. Out of this screening, we have got new PP cases, that is 269, which our CMO has already presented. Out of these diabetes, new 69 person has been screened. So now we were not knowing this, and again, both diabetes and blood pressure, they could screen 24. These are all new cases. They were all new, and they were not knowing that they had a disease in them. But out of this screening, these new cases are now under treatment. How nice it is. As our Principal Secretary has said, and my friend Dr. Tausi has also said, now we are gathering here to discuss about social health. The most important is prevention, which we are not knowing how to prevent ourselves from the diseases. Amikhan naga monogantu pet uni dangor hobo competition ko thage man khaige na dokane health biha se dauro khabole competition ko thage etu pra amikhan la health so biha hoya ase blood is high blood pressure amikhan to hunya se kintu kile stroke pa ase because of high blood pressure. Pressure bishi matha ti uthi na matha ti what you call khun la rasta phatile to khun bhitor ti boi jayega na stroke hoy jay sudu khun dola bole na para ta dia skull bhitor ti phota hoge na brain ke compress kuri na man khan puri ase kintu I can somebody CMO has presented one tablet in a health unit blood pressure thagya khan daily ekta tablet khaile to you are been prevented from getting stroke. Sugar, as my friend has mentioned, dosra country to dhan bhi carbohydrates na thagya la khawle. You know, Naga man khandu Naga special, Nagaland special, ki special khane bishi khai. Manu bishi khan jane ase ki khaile bhalo ho gaya na kun baat to awareness thage. Kintu ami khandu biya rasta pra competition bishi jai jai. So from today onwards, I think it is always good to know your health status. Time to check up fully. COVID aishe tadi pra man muradu sugar khan. Kita apni if you are having a diabetes, your immunity is low. Apni la body de takot na thake hoy jay. To ki bemar ahibo phat apni thorlo. To ani body to thik thak rakhibo lage. Blood pressure asur koile to diet habit ki khaile ami bhalo eto korbo lage. Ami khandu basically be starting hoise, but this is a very good starting. Foreign country hole to apni khan morning ti bere sai colony so exercise kuthai in a bulk bora buri khan alag juan khan alag. One day when I was in Singapore, in the park I was also walking. There was one gentleman, very fair, with short. He was joking like anything, sweating out. I told him, "Gentleman, how old are you?" Then he smiled at me. "I'm only 75, but he looks younger than me." This is how they keep their health. But for us, we are still lazy. Let this be a beginning, and let us go furthermore, better way to achieve it. There are a lot of programs in the medical department which the community have to understand. Supposing from childhood, immunization program. If you can encourage your mothers in the colony, take your child for immunization. Polio, bacha time de polio, dango polio na pabo. BCG highly to when you grow up, TB na pabo. Pertussis. Poila to monkey la cough kujana cough kujana bhitar jana. The DPT, diphtheria, tetanus, and pertussis. Itu DP triple. Itu marle to bemar itu pra. Tamul hole bemar no hobo. Inga medical to bishas de. Itu jana. American community can be. If you don't know, you consult the medical department. Ki hole bhalo amila bachani. Amila help. Janya Pachati, you move forward and keep yourself body fit. Kiman bhalo amegan be Kohima ti mon koleni ase. Abnegan plan kurgena morning 1 hour exercise. Idu community ti halili kimam bhalo. Young to the oldest. And ek khanda pass na lai dile ekdam bhalo. Oh, there are so many educated unemployed, knowing yoga, physical teacher, exercise sika bole. Community can 10 taka hole bhi contribute bhi na mahina ti tai ki tai apni ga sika bole tibi. Morning ti Kohima town colony sob exercise ko thakle kiman sundur ho. In that way we can live longer. Life is very important. Kun bhi morbole mon nai do. Kintu kun bhi amigan laga body care kurul na jani. Murbule to mon nai care kurul na jani. Ido gari from today onwards, including me, I'm telling you, I'm also a very lazy guy. We don't want to die, but we don't know how to care ourselves.
God for bringing us all together here and for making our mission successful up to now. I am a layman. I have nothing much to say. I have been given 5 minutes. I hope I can complete 5 minutes and doesn't exceed 5 minutes also. Rather, first of all, secondly, I would like to say something to my colleagues, my dear ward leaders, who have given their time and energy, effort, everything into this campaign. Though we are short in many things, but I hope department is also satisfied with the wards. Earlier, before this campaign, we had close relationship with 2 government agencies, Administrative Department, DC Office, and KMC. We have no other relationship with any other department. Rather, when it comes to CMO, earlier, even if we try to contact them, they never come forward. I don't say they don't cooperate, but this time, when our CMO, Dr. Vezokola, came and took over charge and started this campaign, the first meeting was held on 15 January at DC's office to sensitize this program and the objective. We were very confused. Kohima being the capital, we were wondering whether it will be able to be completed or not, in time I mean. But energetically, through the able leadership of our CMO and the dedication of the staff, the campaign, the whole area was covered. The 19 wards, everything was covered within 45 days, which is a Herculean task, which each and everybody cannot fulfill in such a short time without strong dedication and leadership. Our ward, when Vezokola came and took over as the CMO, she also created a WhatsApp group where we have become a small global village to understand each other, hear from each other, get the message. We try to cooperate, and we all are part. I hope we have done our best. But the best, like an examination, whatever best we have given, it may not have reached the 100 point. We may be lacking in so many things. I hope the department understand it and try to, later on, try to cooperate with us again in other campaigns to which we are all willing to cooperate and give our effort to medical department, specifically the CMO office, who is looking after the district. I, on behalf of all the 19 wards, would like to convey that even in future, anything you require for us, and anything, whatever you are going to do for us, please don't hesitate to intimate us or try to reach us. I, on behalf of all the 19 wards, will convey today that even in future, we are ready to cooperate with you in whatever ways, in whatever things we can do in a small, humble way. Our wards today cooperate with the government. So, in our humble way, we are always here to contribute, even in the smallest way. So, we are small, our tributaries are small, we are 19 wards with little resources, but with those little resources, we discharge.
Shopkeepers, drivers, housewives who hardly move out from home, grade 4 fixed pay employees, unexpectedly, people responded so well, and we don't get any financial assistance from the government, and all kitchens in Kohima town, all of us, each one of us, we are paying rupees 70 in a month as our sanitation fee. Then besides that, business establishments in Kohima all are paying the yearly tax to different groups and sections. So panchayats are left with no option, no choice, no alternative, even to go for fund drive. The little amount we have given to us, that was a lot to us. Thank you, CMO Office Kohima. Other days, I have no say, but these 2 days campaign organized in my ward, I found our health workers very punctual, sincere, and dedicated.
Thank you, sir. I would like to inform.
I would like to, on behalf of the district administration, thank the Chief Medical Officer Kohima, Dr. Vizokolu, for the initiatives for coming up with this novel concept of going for the social health responsibility in the town, particularly in Kohima town. It was a good initiative, I should say, and whatever we have done, we have just lended moral support to her team, and then that's all from our side. But the rest, due to the commitment, the dedication from the medical team, I think things have been very successful because of the role that they have played. Again, it would not have been a complete exercise if not for the all-out effort, the solid support that we have received from the wards, panchayats, the chairman, the presidents, and the office bearers of the various wards, whom we initially sensitized and we started this program. I think they have come forward and we have worked together. COVID has a lot of, we have seen the negative side of COVID, the difficulties that we have faced. But one good thing about COVID in respect of Kohima is that it has brought us all together. The administration, the medical fraternity, and then the wards and the public. I think this is one area where we have all put our heads together, we have all contributed, and we have put up a solid front. And I think a lot of things were able to be achieved because of this teamwork. And I think this has continued in the form of our social health responsibility. We have already reviewed, we have seen what we intended to do.
Nagaland TV, Sop Manulaga Awas. Watch us live on Geo TV and on your television sets as well. For Dimapur viewers, we are on channel number 10 in Global Chapter, and for Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube and Twitter.